Here with me, you can see the top 5 most powerful home remedies to lower creatinine levels in people with chronic kidney disease. Okay, let's see what our number 5 is. I'll give you a big spoiler. All of the home remedies I'll show you today work. This is a very powerful one. Our number 4 is a home remedy with some really wild claims on the internet. This one is actually proven not just to lower creatinine, but even to fight heart disease. Hello, this is Catherine. Welcome to Double O Kidney. If you suffer from kidney disease, there's a plethora of dubious home remedies you could have tried without much success. But there's also the chance that something that you already have in your pantry may actually work to lower your creatinine levels. This is why I'm making this video today. I've only selected the home remedies that will give you best results in terms of lowering creatinine and improving renal function, because they're proven to work by scientific research. And I've ranked them. All these remedies here with me are things you may already have at home or that are really inexpensive and easy to find. People with kidney disease, more than anyone else, need to know what they can use to improve their health and what will only cause troubles. Yes, taking care of ourselves is a lot easier when we know exactly what we need. So, I'm going to get a little bit in deeper about this topic. I'll show you what home remedies are safe for you and what aren't. Okay, let's see what our number 5 is. This is a very powerful one. This home remedy alone was proven capable of stopping the progression of CKD in the vast majority of patients during a clinical trial. Want to know what it is? Let's see what's inside. It's baking soda! Not many people know about the many benefits of baking soda or sodium bicarbonate because it's more used to wash fruits and veggies or to bake cakes than as a supplement. Yes, this is something that everyone has in their pantry, but it's still so powerful in fighting high creatinine levels. But why is baking soda so useful to fight kidney disease? One of the kidney's job is to keep acidity-alkalinity in balance. In people with kidney disease, this balance is often compromised, so there is more acid in the body than the kidneys can manage. If too much acidity builds up, it will cause further kidney damage. This is a condition called metabolic acidosis, often associated with chronic kidney disease. This condition can result in bone problems, protein wasting, and damage to the kidneys, accelerating the progression of CKD. This is where baking soda can help. It neutralizes excess acids, reduces the payload on the kidneys, and brings the acid-alkaline level back into balance. And this is actually proven by science. firstly tested during clinical trials conducted at the Royal London Hospital and published in the Journal of the American Society of Nephrology, sodium bicarbonate was proven capable of stopping or greatly slowing down the progression of CKD in the vast majority of test subjects. A treatment based on sodium bicarbonate was tested over a period of a year. The decline of kidney function in treated patients was 2/3 lower than those in the control group. This rate of decline was comparable to what would be expected with normal aging. The study showed that treated patients were less likely to develop end-stage renal failure. What are the correct dosages for baking soda? Baking soda can be ingested or taken sublingually. Modern-day kidney experts recommend beginning treatment with small doses of sodium bicarbonate. So start with 1/2 to 1 teaspoon of baking soda a day, and then the quantity will be increased or lowered depending on your blood work. Many patients also take sodium bicarbonate in tablets format. Usually one tablet is 650 milligrams or 1 grain. This product is not very often found in pharmacies, but can be purchased online. Amazon.com has it. But you can also use regular baking soda and buy it at the supermarket, like this one I have. The taste is a bit harsh, but it costs a lot less. Sodium bicarbonate should be taken between meals on an empty stomach to avoid bloating. Are there side effects with baking soda? In some cases, sodium bicarbonate can upset sensitive stomachs or cause nausea. However, it's usually easy for the patient to get used to the taste. Some doctors avoid giving sodium bicarbonate to patients because there are suspects that it can cause elevated blood pressure. However, if your sodium intake is already low, this shouldn't be an issue. Baking soda is less than 30% sodium, so there's less sodium in a teaspoon of baking soda than in a piece of bread. Now, while there is strong evidence of the benefits of using baking soda as a supplement, I strongly encourage you to talk to your physician before starting to use any supplement. So let me know in comment section if you have ever used baking soda as a supplement and if you plan of using it. Cannot wait to hear from you. And if you could give a like to this video while you are at it, it will be great. Thank you. Our number 4 is a home remedy with some really wild claims on the internet. Some say that it can increase energy levels and have all sorts of beneficial effects on health, like helping lose weight, killing bacteria and infections, and even stopping diabetes. There's even people using it to calm the itch and even for the hygiene of the intimate areas. Are all these claims true? Let's find out. Our number 4 is apple cider vinegar, one of the oldest home remedies. Apple cider vinegar for sure has some very interesting properties. Unfortunately, not all claims about it are supported by science. But even if there have been some bogus claims during the years about apple cider vinegar, ACV in short, some of its healthy properties have been proven true by actual studies, and some of the properties of ACV are really useful for kidney disease patients. So today I'll try and make things a little bit clearer about what ACV can do and what it cannot do. What are the proven health benefits of apple cider vinegar? First of all, it can lower blood sugar levels and fights diabetes. Yes, the most successful application of ACV is in patients with type 2 diabetes, the leading cause of chronic kidney disease. This alone would make it interesting for us. Type 2 diabetes is characterized by high blood sugar levels, either because of insulin resistance or an inability to produce insulin. ACV has a powerful effect in keeping blood sugar levels in the normal range and on improving insulin levels. Numerous other studies in humans show that vinegar can improve insulin function and lower blood sugar levels after meals. For these reasons, vinegar can be useful for people with diabetes, pre-diabetes, or those who want to keep their blood sugar levels low for other reasons. And there is another really important benefit of ACV for people suffering from chronic kidney disease. ACV is supposed to lower cholesterol and to improve heart health. Heart disease is not just a risk factor for CKD. It is currently the world's most common cause of premature death. Many animal studies suggest that apple cider vinegar can lower triglyceride levels and cholesterol, along with several other heart disease risk factors. And there are even studies showing that vinegar can reduce high blood pressure. Unfortunately, these studies are mostly done on animals, so there's still need for more evidence to prove that this can be true for humans too. How should you use ACV, apple cider vinegar? As I was saying, ACV can lower blood sugar levels if used during meals. So, start by incorporating it in your diet as a salad dressing, for example. I always recommend to use organic unfiltered apple cider vinegar. Some people also like to dilute it in water and drink it as a beverage. Common dosages range from 1 to 2 teaspoons, 5 to 10 milliliters to 1 to 2 tablespoons, 15 to 30 milliliters per day, mixed in a large glass of water. It's best to start with small doses and avoid taking large amounts. Does ACV have any side effects? Yes, there are some side effects worth mentioning. If you take too much of it, apple cider vinegar can cause drug interactions, especially with blood sugar lowering medications. It can also cause tooth enamel erosion. So, always check with your doctor before increasing your intake of ACV or really any type of supplements. Okay, let's see what our number 3 is. This is a home remedy that packs an incredible list of benefits for the health of the kidneys. It decreases the inflammation, improves immune function, lowers cholesterol and triglycerides, and can even reduce high blood sugar levels. Okay, let's see what we have here. Kefir. This is kefir, as you can see. Yogurt, whole fermented milk, and this is organic fermented soy. What do these have to do with our top 5 of home remedies to lower creatinine? Bifidus is the key here. Yes, all these products are sources of probiotics, and probiotics are proven to be really healthy for the kidneys. As you can see from the lid on this one, this contains Bifidus. Bifidus is a beneficial bacteria species also known as Bifidobacterium. It's a species of probiotics you'll find in fermented foods like yogurt, kefir, kombucha, fermented soy, and even in some types of cheese. I got some examples today, so we can take a look at them and I can show you how to use them. So, all these are sources of probiotics. You can find all these products at the grocery stores or at the supermarket. What are probiotics? Probiotics are the good bacteria present in your gut. Yes, these foods contain live microorganisms similar to the ones already living in your gut. They are proven to offer health benefits when consumed in adequate amounts. The word probiotic itself is often translated to beneficial for life. So these foods are actually going to increase the number of healthy bacteria in the gut and to lower the number of bacteria that can cause illness or inflammation. So, less bad bacteria and more good bacteria, to put it in a very simple way. And balancing the microbiome by replenishing the good bacteria may lead to improved digestion and better immunity. This is especially true for people suffering from chronic kidney disease, since it's harder for them to have a perfectly balanced gut flora. So, how does the gut get out of balance? Many factors can throw your gut out of balance. For example, things like stress, taking antibiotics, kidney stones, lack of sleep can all create problems with the gut bacteria. Also, problems like UTIs, heartburn, constipation can cause a lot of troubles with the gut microbiome. Does any of this sound familiar? In this case, eating more probiotic-rich foods can really help you improving not just your gut health, but the health of your kidneys. Should you eat more probiotic-rich foods to improve your kidney health? Well, the benefits of probiotics are actually proven to help with kidney function. And a lot of people suffering from kidney disease could benefit from a healthier gut. Problems with the kidneys and the urinary tract are often going to increase the chance of gastrointestinal problems, and it's harder to improve kidney function when your body cannot properly assimilate vitamins and micronutrients from foods because the gut bacteria are compromised. And when there aren't enough good bacteria in the gut, those missing bacteria are going to be replaced by other potentially dangerous bacteria. This will greatly increase the chance of infections. More probiotics and a more balanced gut flora also means that your body will be able to process uremic toxins better, reducing the workload on the kidneys. What are the best way to add probiotics to your renal diet? Most of the studies showing benefits used dosages of 1 billion to 100 billion live organisms or colony-forming units, CFU in short, per day. Now, yogurt brands to put the probiotic label on their yogurt only need 1 billion CFU in a single yogurt. Obviously, there could be more, but we don't know how much because it's not on the label. Kefir usually has more probiotics in it, about 25 to 30 billion per serving. Now, if you don't want dairy in your diet, there is the option of soy or even of using probiotic supplements. You can get even more CFU from supplements, and you will also know for sure how many live organisms you will find in a serving, since food brands aren't usually going to put this info on the labels of their yogurts. What are the side effects of probiotic-rich foods and supplements? The good bacteria present in these foods already exist in the body, so probiotics are totally safe for most people. But there are still a couple of things to say. Like many foods, they can trigger an allergic reaction or cause mild stomach problems. There could be mild symptoms, especially the first few days you start taking them. Those symptoms usually go away very fast as soon as the body gets used to having more of these bacteria. So, while these side effects are unlikely, I still recommend you to talk to your doctor and to get informed before making any significant changes in your diet. Okay, time to see what our number 2 is. This one is actually proven not just to lower creatinine, but even to fight heart disease, lower cholesterol, and even the risk for cancer. It is omega-3, one of the best supplements for the health of the kidneys. Omega-3 are responsible for most of the benefits associated with a diet rich in seafood. In fact, few nutrients have been studied as thoroughly as omega-3 fatty acids. They have a huge list of benefits, and all of these benefits are proven by several studies. Omega-3 can protect against heart disease and stroke. They can reduce the symptoms of mental disorders and ADHD, can fight inflammation in the body and reduce mental decline in the elderly. They can improve sleep quality, bone and joint health, reduce fat in the liver, and are even associated with a lower risk for cancer. It's a lot of benefits for just a couple of pills, right? However, most people who eat a standard Western diet are not eating nearly enough omega-3 fats. So, it's a good idea for everyone to add more omega-3 to their diet, but especially for people with CKD. Question: can omega-3 lower creatinine levels? Omega-3 fatty acid has been shown during several clinical trials to reduce high blood pressure, one of the leading causes of CKD. There is also evidence that it can reduce proteinuria, triglycerides, and inflammation in people with kidney disease. During long-term, double-blind clinical trials, this supplement has also shown to reduce the progression of kidney disease in IgA nephropathy patients. Yes, this home remedy is really great. So if you know anyone who could benefit from it and who doesn't know about all these benefits, send them this video now. How to take omega-3s? The best way to ensure optimal omega-3 intake is to eat fat fish at least twice per week. Fishes more rich in omega-3s are those that cost less because omega-3s come from fish oil, and fishes more rich in oil are usually considered less tasty. We're talking about mackerel, herring, sardines, anchovies, salmon. Yes, these are some of the healthiest fishes. But you can also find omega-3s in chia seeds and flax seeds. However, if you don't eat a lot of fat fish or seafood, you may want to consider taking a supplement. In fact, most of the studies on the benefits of omega-3 use supplements. Actually, I take omega-3s too. The benefits are too many even for healthy people not to take it. Are there any side effects involved with omega-3s? According to the Food and Drug Administration, FDA, taking up to 2,000 milligrams of combined EPA and DHA per day from supplements is safe. In high doses, omega-3s have blood thinning effects. Speak to your doctor if you have a bleeding disorders or are taking blood thinning medications. Now, before I'll show you our number one, a lot of people here are using this program to improve their kidney function and lower their creatinine. Yes, there are some very inspiring success stories here on Double O Kidney. People were basically able to reverse their kidney disease thanks to this program. I'm leaving a link here if you want to know more. And our number one is water. I cannot make a list of home remedies that actually work for the kidneys without including water. It's the most important thing and it's the basis for any detoxifying program. More about detoxing in this video.